Nigeria Center for Disease Control confirms 196 fresh Covid-19 cases. Federal government directs reopening of banks, government offices, insists on gradual reopening of economy. In international news, U.S. Food and Drug Administration considers approving emergency use of a coronavirus treatment. And in sport, Super Eagles coach Gernot Rohr accepts salary cuts.
This is ANN News.
I am Olajumoke Olatunji. The Nigeria Center for Disease Control has confirmed 196 fresh COVID-19 cases in 11 states and the Federal Capital Territory. Lagos again recorded the highest number with 87 cases, followed by Kano with 24 cases. Gombe recorded a spike with 11 new cases and Kaduna had 17 infections. The Federal Capital Territory confirmed 16 new cases while Katsina booked 10. Sokoto, Edo, Borno, Yobe, Ebonyi, and Adamawa states recorded cases in single digits. NCDC also announced 7 deaths, which brings to 51 the total number of fatalities. 307 persons have been discharged so far. Nigeria has succeeded in securing a $3.4 billion loan from the International Monetary Fund with some conditions. Minister of Finance, Budget and National Planning Zainab Ahmed had reviewed Nigeria was ready to draw up her 100% of its $3.4 billion contribution to the IMF. The loan must be repaid within 5 years. The federal government says it had a virtual meeting with all African ministers of finance to collectively solicit for a suspension of debt service obligations for this year and next. The federal government has directed all its offices, banks and manufacturing companies to reopen on Monday. Chairman of the Presidential COVID-19 Task Force, Boss Mustafa, says the federal government is insisting on a gradual reopening of the economy. Reporter Kelechi Emekalam has the details.
Movement restrictions in Nigeria's capital, Abuja. Schools, private and government organizations and several other businesses all shut down since March 30. Movement's been restricted to only essential service workers. The Medical Association advised an extension of the lockdown as cases of COVID-19 continue to surge. But that decision doesn't sit right with many residents here.
I think it will curb it, but the way things are going, that everybody is a government of his own, providing water for themselves, electricity and food. My brother, it's not easy. Some people decide and prefer to die in the hands of COVID-19 than remain indoors and die there.
Nigeria have lost a lot. Individuals have lost a lot. How do you expect a common man to feed his family for this lockdown? So to me, I don't see anything extend or the economic of the country is shaking. We are not heading anywhere if we continue.
A large number of residents in the affected cities are daily wage earners whose source of livelihood have been completely cut off. Many are yet to access government palliatives designed to cushion the hard times of the lockdown.
Now we have been hearing about palliative and a lot of persons are not benefiting from it. And this lockdown, a lot of hungers. If we decided to extend this time, I think this might lead to death because hunger kills more than this virus.
Government, worried about the impact of the lockdown on the nation's economy, has now decided to relax measures by the 4th of May. Selected businesses would be open between the hours of 8 a.m. and 6 p.m. and an 8 p.m. to 6 a.m. curfew would be in place. But the ban on interstate travels, social and religious gatherings still stands.
The Lagos State government has introduced strict guidelines for movement and reopening of businesses ahead of the expiration of the lockdown imposed by the federal government on the Federal Capital Territory, Lagos and Ogun states. This in a bid to reduce the risk of contracting COVID-19. Governor Babajide Sanwo-Olu says the state government will implement the dusk to dawn curfew from 8 p.m. to 6 a.m. starting Monday. Passenger buses will only be allowed 60% capacity. Drivers and passengers would be required to put on face masks and apply hand sanitizer. The governor also banned all commercial motorcycle or Okada with the exception of those used for courier and logistics purposes. Sanwo-Olu also restricted passengers to 2 per trip, excluding the driver in tricycle cabs or keke napep operating in unrestricted areas. Banks will reopen on Monday from 8 a.m. to 2 p.m. daily and must adhere to social distancing rules. Employers have been mandated to provide face masks and thermometers on their premises. The Niger Governors Forum says it is collaborating with the Niger Police Force and the National Union of Road Transport Workers on how best to enforce the restriction on interstate movement to curb further spread of the virus. NGF Chairman and Ekiti State Governor Kayode Fayemi says local government chairmen will have buffer security surveillance along state boundaries. Fayemi said this in the firm's communique at the end of its 7th COVID-19 teleconference meeting on Wednesday.
Coming up, African news. African countries are grappling with medical waste disposal amid COVID-19. And later, international news. U.S. Food and Drug Administration considers approving emergency use of a coronavirus treatment.
You are watching ANN.
Remember that Nyanya was telling her I want marry. She dey come my house today. I'm gonna tell her to marry me.
Remember what I taught you about playing music from the internet?
I'm gonna play romantic music for her. The body remains small, make it done. Will you marry me? I have a surprise for you. Google, play me a romantic music. Everything is okay. Network is shaky. Google, play me a romantic music. Google, play me a romantic music.
Maybe I should go.
Don't let poor internet ruin special moments. Join the super fast and reliable 4G network and get double data.
Now in the watch.
Welcome back. This is ANN News. African countries are experiencing mounting contaminated garbage. Hospitals and medical facilities are getting worried as COVID-19 produces many more patients. Medical facilities are now grappling with how to safely discard this waste, like disposable personal protective equipment, masks, and other items. Daniel Arapmoy reports.
Millions of tons of hazardous medical waste is being churned out as the world moves to shield itself from COVID-19. Used masks have been disposed of like any other trash, but some individuals and retailers have been collecting and reselling these very masks to unsuspecting buyers, with potentially devastating health consequences. Properly disposing this waste is proving to be an even bigger headache.
I think it's good to think widely, because some of the masks that are going to be disposed of might end up to be serious more carriers or vectors compared to what we're currently experiencing.
We are educating our people on safe disposal. Of course, in the villages, we know it's a bit tricky, but we are urging people, maybe they can either burn or even throw it in their pit latrines.
Some institutions like this one in Machakos, Eastern Kenya, are ahead of the pack. This is an incinerator. This is where clinical waste ends up. But such equipment is not readily available for many health facilities, and so hazardous waste can end up in the normal traditional garbage dumps. Environmentalists say that the material from used masks can be recycled into other products.
If you pick up the mask and mix it with what you call PET, you can extrude it into something, depending on the mold that you have.
A number of governments in Africa have made it mandatory to wear a face mask in public. But few people realize that used masks are considered hazardous waste and must be disposed of properly. With COVID-19 cases on the rise, governments will be confronted with challenges that require prompt solutions as concerns grow over how to deal with the piling medical waste.
The impact of the coronavirus is both immediate and dreadful, but there is another deep emergency: the planet's unfolding environmental crisis. Scientists say biodiversity is in steep decline, and climate disruption is approaching a point of no return.
The coronavirus lockdown in South Africa has affected many businesses, including informal recyclers and trash collectors. They were forced to shut down when the lockdown kicked in and would have to wait until the ban on waste picking is lifted. The story is the same for other businesses, including those that deliver produce and other essential items in the country. All have been struggling to survive. Sumitra Undu has the story.
Jose Tenente and his family have been running this food business in Randburg for over 30 years. One would expect it to be thriving in a sector that's essential services and allowed to operate during this lockdown. But it's not. The stringent rules are affecting other areas of Jose's business. The fast food side is closed and delivery trucks stand idle.
6 trucks now standing with no deliveries, going out, a major stock loss that we had in stock that was built up, and once the lockdown was initiated, all that stock was going to waste. We've got a lot of customers that still are helping us, supporting us, coming through. They dedicated and loyal customers, so we are very grateful to them.
Jose Tenente is still open, but the bulk of his business forms a bigger part of a food chain that supplies restaurants. That part of the business has ground to a complete halt. The president has announced a move from level 5 to level 4 restrictions in the lockdown from the 1st of May. This means more, but not all businesses will be able to reopen, and only a limited number of employees will be able to return to their posts.
A major blow to our staff. Because of that, we've had to let some staff stay at home. We can't have all the staff, so we've been alternating staff between trying to give each one the chance to work 2 weeks, 2 weeks.
Government is making more funding available to help businesses and ordinary South Africans during this time. To date, the president announced $42 billion in various relief efforts. But getting access to relief funding is not easy.
We need departments such as the small business department to be able to accelerate the time it takes agencies such as CIFA to pay attention to small businesses and also to respond to them for applications that they've made for financial relief. It doesn't make sense that a business applies and it only receives an answer possibly even a month later when it has got pressing challenges.
The delay in distributing these rescue packages is putting a strain on many businesses. If they shut down, unemployment will go far beyond the record high that it's at now. Many companies are already laying off their workers to cut costs. But Tenente and his family are trying to save their business and their employees' jobs.
Guinea-Bissau's Prime Minister Nuno Gomes Nabiam has tested positive for the novel coronavirus alongside 3 members of his cabinet. The Health Ministry said on Wednesday, Nabiam, Interior Minister Boche Kandeh and 2 other ministers were diagnosed on Tuesday and have been quarantined at a hotel in the capital, Bissau. Health Minister Antonio Duena did not provide details of the official's condition or treatments, but warned the country's rate of infection could rise. The country has confirmed more than 70 COVID-19 cases so far, including 1 death.
When we return, international news. U.S. Food and Drug Administration considers approving emergency use of a coronavirus treatment. And later, sport. Ghana's Roar accepts salary cuts.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News. The U.S. Food and Drug Administration is considering approving the emergency use of Remdesivir as a coronavirus treatment. U.S. government top infectious diseases scientist Dr. Anthony Fauci says there is optimism, albeit cautious, about early trial results of the drug. But he warned that there is still need for proper review of the results that have showed Remdesivir could shorten recovery time in patients infected with the virus. The drug's manufacturer, Gilead Sciences, says Remdesivir has not been licensed in the U.S. or anywhere in the world. It has also not yet been declared safe or effective for the treatment of COVID-19. The U.S. Commerce Department's reported on Wednesday the U.S. economy contracted at an annual rate of 4.8% in the first quarter amid the COVID-19 pandemic. This is the biggest decline since the Great Recession. As Dan Williams reports, this could be blamed on widespread stay-at-home orders and other measures aimed at containing the coronavirus.
The number of confirmed COVID-19 cases in the US climbed past 1 million this week. Economic output is heading in the opposite direction. GDP shrank by 4.8% in the first quarter, with a plunge in consumer spending partly to blame. State governments have told millions of Americans to stay home, so people aren't going to stores like these. The second quarter is expected to be even worse.
You might see a good strong number in Q3. I'm not saying you're not, but once again, you got to compare that to the extent of the decline. And what's going to keep the consumer from coming back is, first off, an unwillingness to re-engage. You know, Macy's might open on 34th Street, but it doesn't mean everyone's going to rush back into the department store.
Medical workers in the front lines of the COVID-19 pandemic are some of the most at risk when it comes to contagion. In Mexico, a new product to keep these vital workers safe is rolling out across the country. Please note that things in this report by Alasdair Beverstock are simulations that do not involve contact with actual COVID-19 patients.
For Yoatzin Bernal, a paramedic on the front lines of the COVID-19 pandemic, contact with coronavirus patients is a daily risk.
It's exciting, it's nerve-wracking, we're scared, but we have to do it. And despite all our safety measures, a small risk of contagion still exists.
But now his ambulance is equipped with a new tool, which he demonstrated to us with the help of a volunteer who is not sick. Local authorities in Mexico believe this bed can protect him and thousands of other medical workers.
This is the XE isolation capsule, originally designed for meningitis and tuberculosis patients in Mexico. The prototype was quickly rushed into full-scale production with the arrival of COVID-19 and is now being used across the capital to help keep medics safe from the virus.
This capsule has been a great help in transporting infected patients and in protecting the medical staff who work in the ambulances.
Costing around $2,000 per unit, the capsules are equipped with filtered airflow systems, as well as built-in gloves for manipulation of the patient inside, without the need for direct contact. It was developed by XE Medical, a private emergency services company run by Fernando Aviles, who says his design doesn't only serve for ambulances.
In the space of a month, we had to scale up production to industrial capacity using robots and large factories because the demand was so large. The Marines are using it, as is the Army and the Ministry of Defence, and many private hospitals, where they become very useful for moving patients around inside the hospital.
Mexico has entered what the government calls Phase 3 of the pandemic, marked by rapid spread of infections, and Aviles says keeping medics safe must be the country's top priority.
Keeping medical workers safe is the most important thing. Without them, we have no one to defend us, and that goes for all medical staff, doctors, nurses, paramedics, even sanitation workers and hospital administrative staff. They are critical. A hospital doesn't function without them.
For medics on the front lines of the pandemic, equipment designed to combat contagion will be key to their own safety and Mexico's ability to battle COVID-19.
Up next, sports. Super Eagles coach Gennett Rowe accepts salary cuts. Mr. Williams.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News in Sport. Super Eagles coach Gennett Rowe up a fraction of his salary as contribution to the fight against COVID-19. This is treated like a pay cut. Argentina ended their football season on Monday with no relegations for 2 seasons. President of the Argentine Football Association, Claudio Tapia, says the idea would be to restart play when authorities allow and with maximum security. President Alberto Fernandez has extended mandatory nationwide quarantine period until May the 10th. That is ANN News this evening. Thank you for joining us. For details on these and other stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.